Sir, please explain yoga consideration for anterior pelvic tilt.
Okay, so you want to understand yoga consideration. For anterior pelvic tilt, right? Okay. Research have shown that 70% to 80% males and females exhibit slight anterior pelvic tilt. So it is already research have mentioned that there is slight pelvic tilt, right? And that is normal. That is normal. So you don't have to worry if it is slight anterior pelvic tilt. But if there is crossover syndrome, if there is crossover syndrome, then you need to correct it. You need to correct it. Right? Now, what is crossover syndrome? Some muscle group remain weaker and some muscle group become tight. Right? The weak part need to be strengthened with yoga asanas and the tight muscle need to be released with yoga asana. So let's understand the anatomy first. This is your femoral head, then neck and the greater trochanter. This is your femur, which is lateral view. Here is your tibia and then fibula. This is your iliac crest. Okay. We have coccyx here, then sacrum, and then we have lumbar region. Right? L5, L4, L3, L2, L1. This is lumbar region. Then we have thoracic region. T12, T11, T10, T9, T8. I am drawing some of these vertebrae, not all. So let's understand which muscle group is tight. See, the erector spinae muscle, which is holding your spine here, and the sacrospinalis muscle. Erector spinae muscle, right, becomes tight. And we need to release this muscle with proper yoga asana. There is muscle which is hip flexor. This is psoas major, right? And combined with iliacus muscle, it becomes iliopsoas. Right? This muscle becomes tight. We have one more hip flexor which originates from AIIS. AIIS, anterior inferior iliac spine, biarticulate muscle head, and this crosses two joint, attaches onto the patella here, right? So this is called rectus femoris. So these muscle groups are tight and we need to release them with yoga asanas. So which are the weaker muscle? We have abdominal muscles, right? Rectus, abdomen, transversus abdomen, which is your natural weightlifting belt, and then we have external and internal obliques. These muscles tend to become weak and we need to strengthen them with proper yoga asanas. At the hip region, we have gluteus maximus, lower fiber coming from coccyx, which is inserting onto the gluteal tuberosity, middle fiber, and the upper fibers. This is gluteus maximus, right? Then we have gluteus medius, which is inserting onto the greater trochanter, and then minimus. Gluteus medius and minimus. These tend to become weak, right? Now, the weaker group of muscle and the tight muscle creating crossover syndrome, and we need to correct them. The tight muscle need to be released and the weaker muscle need to be strengthened. Okay, so what yoga asanas will help us? Let's see them. Ardha Pavan Muktasana. Now, what is Ardha Pavan Muktasana? I will draw the sketch. The practical session will be done with proper yoga instructor in the classroom lecture, right? So this is yoga asana called Ardha Pavan Muktasana. Now, in this kind of yoga asana, we have to take one leg towards the chest and hold as per the guidelines of yoga instructor, right? And once you are holding one leg towards the chest, right, this is going to strengthen the weaker part of gluteus maximus, right? And this is going to release the tension which is built on erector spinae, right? So this is how it's going to strengthen the gluteus maximus, and this is going to help to release the tension onto the erector spine. There are many benefits of yoga. If you want to understand one more, which is not related to this topic, but I will try to explain it. Okay? That's it's going to help you in digestion. How digestion will be improved? Let's see. So this is stomach here, and then we have ascending colon, right? And then we have descending colon, and then rectum here, right? Right. Now, when you are holding the knee onto the chest with right side, this is going to compress the ascending colon and improve the digestion. And when you are doing same with the left leg and holding onto the chest, it's going to compress the lower abdomen and compress the descending colon, and this is going to improve the digestion, right? So this is the one aspect which is going to help you health wise. Now we are going to understand about the muscle strengthening, back to the muscle strengthening and the releasing tension onto the erector spine, right? So Ardha Pavan Muktasana, once done, it is going to strengthen the both side of gluteus maximus, as well as it is going to release the tension which is built onto the erector spine, right? Now let's take one more asana. Anjaneyana asana. This Anjaneyana asana is going to release the tension which is built onto the hamstring muscle, as well as it is going to release the tension which is built onto the rectus femoris muscle. And here this rectus femoris is getting strengthened, right? This is opening the chest cavity. It is strengthening the abdomen muscle as they are weak here, right? And it is nicely releasing the erector spinal muscles when you are taking your hands upward. Thus, this Anjaneyana is going to help you. More details, more depth session will be covered in the lecture itself. Let's take one more asana. This is called Satu Bandhasana. Right? This Satu Bandhasana is going to release your iliopsoas muscle here at this point. Which muscle is tight here, right? So this iliopsoas muscle is going to release when it is done in this kind of asana called Satu Bandhasana, right? This is going to strengthen the gluteus maximus when it is going to be squeezed. When you take your buttock upward, it is going to squeeze the gluteus maximus, right? Thus, it has many benefits. More details, more explanation will be covered in our upcoming yoga course, level 3 yoga instructor. Thank you very much.